Modern industrial labor carries inherent physical risks. Moving thousands of tons of material, operating heavy machinery, and extracting resources require working in environments where a single engineering failure can be lethal. In 2010, the official data recorded 4,690 traumatic workplace fatalities in the United States. That averages out to 13 workers dying on the job every single day. Beyond immediate physical trauma, long-term exposure to hazardous conditions, like silica dust or chemical toxins, resulted in an estimated 50,000 additional deaths from occupational diseases that same year. For non-fatal incidents, the Bureau of Labor Statistics reported that 3.8 million workers suffered a job-related injury or illness. But when independent epidemiologists look at the same landscape, they find a massive discrepancy. Their estimates show the true toll of job injuries is 2 to 3 times greater, between 7.6 and 11.4 million incidents annually. The government frequently points to historical declines in workplace mortality to validate the efficacy of the current regulatory system, framing the framework as a success. This table displays the Bureau of Labor Statistics employment-based workplace fatality rates. Looking at the far-right column, you can track a steady downward progression of fatalities from the 1970s through the early 2000s, appearing to show a system bringing danger under control. However, evaluating safety through this official lens creates a blind spot. A regulatory framework that operates using data missing half of all injuries inherently misallocates its resources. It generates a systemic illusion of safety, measuring its own paperwork rather than actual risk mitigation. To understand how millions of injuries vanish, we have to look at the structural mechanics of the Bureau of Labor Statistics annual survey. The survey relies almost entirely on safety logs provided by employers themselves. Right away, the data set is truncated. The BLS methodology categorically excludes massive populations from the count, instantly removing more than 1 in 6 workers from the survey. For the remaining workers, capture-recapture studies, like a 2006 Michigan analysis, reveal severe flaws in employer logs. Cross-referencing the BLS survey against state workers' compensation databases, researchers found the BLS missed 50 to 69% of the injuries that state systems caught. This massive undercount is driven by clear microeconomic incentives. Employers know that higher reported injury rates translate directly into higher workers' compensation insurance premiums, creating a financial penalty for accurate logging. Corporations also deploy internal safety incentive programs that perversely discourage reporting. By offering financial rewards to departments that go a certain number of days without an injury, workers are pressured by management and their peers to keep quiet when accidents happen. These structural reporting failures do not affect the workforce evenly. The data distortion concentrates most heavily in specific demographics. Hispanic and Latino workers carry a highly disproportionate fatality rate of 3.9 per 100,000 workers, significantly exceeding the national average. Looking closer at those fatalities, 62% occur among workers born outside the United States. These high-risk groups face unique reporting barriers. Fear of employer retaliation, severe language barriers, and concerns over immigration status ensure that countless non-fatal injuries in these populations never make it onto an OSHA log. The official U.S. injury data fails to represent true hazard incidents. It effectively measures only the most visible, economically sheltered fraction of the workforce, leaving the most vulnerable workers entirely off the ledger. Shifting from the flawed data collection to actual enforcement reveals that an agency is struggling against sheer physical scale. The Occupational Safety and Health Administration holds regulatory jurisdiction over approximately 8 million individual workplaces. To police this expanse, federal and state OSHA programs command a total of only 2,178 inspectors. The mathematics of this resource constraint are absolute. At current staffing levels, it would take federal OSHA 131 years to inspect every workplace under its jurisdiction just one time. This leaves the United States with an inspector-to-worker ratio of 1 inspector for every 58,000 employees. For context, the International Labor Organization recommends a baseline benchmark of 1 inspector for every 10,000 workers. The U.S. system operates with less than a fifth of that density. Because inspections are so rare, the entire enforcement model relies on the threat of financial penalties to force corporate compliance. In 2011, the median federal penalty issued after an investigation into a worker fatality was just $7,900. Comprehensive industrial safety controls, like proper ventilation systems, automated machine guards, or structural redesigns, often require hundreds of thousands of dollars in capital expenditure. When a company weighs a major capital investment in safety against the possibility of a $7,900 fine assessed on a 131-year inspection cycle, the fine ceases to be an economic deterrent. It simply becomes a negligible operational cost. With civil penalties operating as a minor tax, true deterrence requires the threat of criminal prosecution. But the Occupational Safety and Health Act contains severe statutory limits on criminal liability. To trigger a criminal charge under OSHA, prosecutors must prove a willful violation of safety standards, and that specific violation must result in a worker's death. Endangering workers or causing severe, permanent injury is not enough. Even when those strict prerequisites are met, the statute caps the penalty as a misdemeanor, carrying a maximum sentence of just 6 months in jail. Compare this occupational framework with how the federal government enforces environmental laws through the EPA. Under federal environmental statutes, prosecuting a corporate officer does not require a fatality. Proving knowing endangerment of the public or workers is classified as a felony. The results of these differing legal standards are stark. Since OSHA's inception in 1970, the agency has prosecuted a total of only 84 criminal cases. Across 4 decades, a period with over 370,000 workplace deaths, defendants served a cumulative total of just 89 months in jail. In contrast, the EPA initiated 371 criminal enforcement cases in fiscal year 2011 alone. In that single 12-month period, EPA defendants were sentenced to 89.5 years of jail time. The disparity is so severe that the Department of Justice launched the Worker Endangerment Initiative, a program specifically designed to bypass OSHA limits by prosecuting deadly workplace negligence using the much tougher criminal provisions of environmental statutes. Occupational safety law is structurally designed to limit corporate liability, permitting a level of negligence inside a factory that environmental law explicitly punishes as a felony on the outside. The compounding failures of bad data and weak enforcement carry severe macroeconomic consequences. Recent studies estimate the true cost of occupational injuries and illnesses to the U.S. economy sits between $250 billion and $300 billion every single year. This massive economic drain is driven by direct medical payouts and the heavy indirect costs of lost productivity, overtime, and extensive retraining. And the bureaucratic apparatus meant to alleviate this burden is immobilized by regulatory latency. A review by the Government Accountability Office found that the average time required for OSHA to develop and set a new safety standard is more than 17 years. Critical updates to limits on combustible dust and deadly silica exposure languished in regulatory review for over a decade, delayed by intense lobbying and required impact assessments. During those 17-year waiting periods, the human and economic costs accumulate. In the case of silica alone, OSHA estimates that 60 preventable deaths occur each year the updated rule is delayed. The U.S. Occupational Safety Framework functions in a closed loop. Flawed data inputs deliberately undercount millions of injuries, which are then used to justify and maintain an under-resourced inspection force. Even when that overstretched force identifies a hazard, statutory penalty caps effectively neutralize any threat of economic deterrence. Accurately evaluating the safety of the American workplace requires discarding the official top-line numbers. The reality is found by mapping the underlying arithmetic of missing data, severe resource deficits, and intentional legal constraints.